Hemochromatosis is just kind of one of those diseases, again, that just has a very specific clinical presentation, lab value, and we just need to be able to recognize it on ultrasound in conjunction with patient history. Hemochromatosis causes your body to absorb too much iron from the food that you eat. Excess iron is stored in your organs, especially your liver, heart, and pancreas. Too much iron can lead to life-threatening conditions such as liver disease, heart problems, and diabetes. Sometimes referred to as iron overload, iron deposits can be found within the liver. Knowing that hemochromatosis can lead to cirrhosis, the appearance is more macronodular and darker due to the iron. So there are two types of hemochromatosis. The first is the primary type, and that is inherited. The genes that cause hemochromatosis are inherited, but only a minority of the people who actually get the genes ever develop serious problems. Secondary hemochromatosis results from having another disease, and it's typically going to be seen with anemia, which is low red blood cells. We also see it with liver disease and with people who get blood transfusions. White people of Northern European descent are more likely to be the ones to inherit this disease, and men are actually 5 times more likely to get it than women. So most of the people with hemochromatosis don't ever get any symptoms. In men, the symptoms tend to show up sometime between the ages of 30 and 50, where women don't typically show signs of it until after 50 because of menopause. That may be because they are losing iron when they get their periods and give birth, so it kind of balances that iron overload. Symptoms of hemochromatosis do include pain in the joints, especially the knuckles, feeling tired, bronzing of the skin, unexplained weight loss, and then some symptoms don't ever show up until late stage conditions because then the patient is in liver failure or has cirrhosis, diabetes, or heart failure. As mentioned on the previous slide, there is some bronzing to the skin, which is seen here in the patient's hands that are in the middle. So in the introduction, I mentioned that this disease is indicated mostly by lab tests, and that is exactly where we're going to see this. We're going to see an increase in iron in the blood. If the hemochromatosis is causing liver damage, then we're going to see some effects on the liver, so that'll be increased LFTs and direct bilirubin. Doctors can treat hematosis safely and effectively by removing blood from the body, which is phlebotomy, on a regular basis. So just as you're donating blood, they would remove that blood, that extra iron comes out with the blood, and then the body will replace the red blood cells pretty quickly. Ultrasound probably isn't the best way to diagnose hemochromatosis, but if we have a patient who has history of it, then we want to know what it looks like on ultrasound. So there aren't a whole lot of pictures of hemochromatosis on the internet, so that kind of tells you again that we're not going to see a whole lot on ultrasound. But with hemochromatosis, sometimes we are able to see the iron deposits, and what we'll mostly see is just a really coarse looking liver. So the coarse echo texture, and then possibly some kind of irregular areas that represent those iron deposits. Don't forget to comment on what hemochromatosis appears like on ultrasound using ultrasound terms.